Hello, Georgetown and other communities near us. I'm Beverly Enos. This is Spotlight Georgetown. You can find us Fridays, Saturdays, and Sundays, 8 in the morning and 8 in the evening. As part of your cable station here in Georgetown, would love to have you come down, learn to run a camera, learn to do some editing, be on the show with me. I'm always looking for people to interview, and if you know someone else that you think would make a great interview, please let me know. Now today we're talking to Catherine Ricketson, and Catherine is here from the Merrimack, she's the bereavement coordinator from the Merrimack Valley Hospice.
Hello.
So lots of information that we're going to be covering today. Now, where are you actually from?
I'm actually from New York.
Oh my goodness.
And I married a New Englander and came to Boston. And I actually live north of Boston in Westford, Massachusetts.
Okay, so that's not too far.
No.
Now, how did you get into this? What type of education or how did you get in this direction?
Well, it's interesting. I'm a social worker, and while I was at home raising my children, I ended up volunteering for hospice. And I loved it so much. I never anticipated working in hospice. I had formerly worked with children in the court system and homeless children and so forth, children who were in crisis. And I found that I just loved the work so much. Wow. I decided to work for hospice.
What is hospice? You hear a lot of things, but exactly what is it?
Hospice is care for people who have a life-limiting illness and who have decided to, they've thought about their phases of care, and together, hopefully with their doctor, they've now come to realize that their curative treatment may be coming to an end, and now it's time for a new phase of care. And so we partner with families to help people stay, in control of their life and maintaining a high quality of life at the end of life.
When it comes to the care and comfort
Exactly.
stage.
Exactly.
Who qualifies for hospice?
Well, if again, as I said, if you have a life-limiting illness, and it seems the official diagnosis is if your prognosis, say, is 6 months or less, that's the official prognosis, but of course no one ever knows, not even your doctor, so it's a best guess. And so people are on hospice sometimes much longer, much shorter time, and it really depends.
Does hospice provide 24-hour care in the home?
No, our emphasis is on partnership with our families. We work together with the family and the patient very closely to provide care, but we have a whole clinical team that provides support to that patient and that family. What
would the hospice care? What are the services that they would get from hospice?
So when you come on to hospice, as I said, you get this team, and it's just wonderful care. You get, in addition to your nurse, you get a social worker who helps you and your family. You get a chaplain if you would like. They're all interdenominational, serving all people. And you get a volunteer often, if you would like to have one. It's like a comprehensive style of care. So
with the volunteer, that would be someone to come in and talk to you,
yes,
sit with you,
yes,
watch television with you.
Exactly how I started in hospice. I would just go visit with my patients, and whatever they wanted to do, we would do.
You don't provide nursing care?
We do provide nursing care,
okay.
Yes. The nurse is really the heart of the hospice team, and she or he come in and work together with you on your medications and all of the care that your physician has determined that you need.
Now, is this through the VNA?
Well, in our case, we're 3 agencies under one umbrella.
Okay.
So even though we're one of the oldest hospices in Massachusetts, we're over 30 years old.
Wow.
And we were started around, a kitchen table with an idea from some VNA nurses, and actually started in a little church, West Parish Church in Andover. And so from that grassroots level, 30 years later, we're still here providing hospice care. So nurses are the core of hospice care.
Okay, and is it hospice nurses, or is it?
Yes.
Okay, it's not the VNA nurses.
No. We often have families, as I said, we have 3 agencies. So we have Home Care Inc., the VNA, and Merrimack Valley Hospice. So what's wonderful about our agencies, you
so
can
you're
sort
all
of
working in conjunction.
Yes, we can bridge people back and forth from the kind of care that they need.
How long can a person have hospice?
They can have hospice for as long as they qualify. And what's interesting with hospice is that many people come on hospice, they often improve because they get so much supportive care that they often come off hospice, they get discharged, they can come back on at any time. And so for some people, it's quite a long process.
Now, if someone has a long-term illness,
yes,
and this is sort of what you expect to be the ending at some point in time.
Right.
But then they get better and perhaps a new surgery comes online or something comes up.
Yes.
So they can leave hospice.
Yes.
Can they come back into it afterwards?
Yes, they can. And they can be discharged to more care, what we call curative care, or even just normal life.
And that's it. Okay.
Yeah.
Is the decision for hospice something that you're just giving up hope, or
not at all?
And
not at
it
all.
should be the opposite.
It is the opposite. I can tell you that you know, the motto for all hospices, it's about how you live. So it's about keeping us in control, about making our own choices for the way we want to be cared for, and this is so very important. And we facilitate a lot of communication with the patients and their physicians, their families, through our social workers and our chaplains.
So the families have some say in all of this as well?
Oh yes, the families are, as I said, I feel like we partner with our patients and their families.
You have a home. You have a hospice house.
We do.
Is it new?
Well, it's 2 years old.
That's
now.
new.
Yes.
And it's in Haverhill.
It's in Haverhill, and I hope you can show some pictures of it. It's absolutely beautiful.
I've heard that.
And it was designed for this purpose. So you will see some hospice houses that have been converted for hospice care.
From a regular home.
From a regular type of facility. But in our case, we were able to build from the ground up. And when you show the pictures, you'll see how beautiful it is. Each patient has a suite, all their own. And it's very private. There's room for families to stay with the patient at all times. They have their own little patio. They all face the beautiful woods. We have walking paths. And then the common areas are, I must say, absolutely beautiful. Our playroom for children. We have a meditation room, a library. It's wonderful. And
what would the kitchen facilities be? Does somebody come in to cook for the patients, or?
Well, we do have a kitchen, you know, that supplies the diet necessities for our patients. We have a little cafe for the families. It's a really pretty area where the families can sit and relax, have a cup of coffee, make themselves a cup of tea, and just relax.
I spent a couple of weeks at a Ronald McDonald House, a couple
did.
of different times.
Yes.
And it sounds very much like that.
It is.
And we'd come home from the hospital, and 3 or 4 of the moms at 2 or 3 or 4 o'clock in the morning, and you'd find somebody in the kitchen making breakfast.
And you know what that atmosphere is like then. You sometimes get to know other families. You certainly get to know the staff, and they get to know you.
Now, what is the staff at the home, at the house?
At the hospice house, you have another whole clinical team. So under, you know, the director of the hospice house, you have nurses, social workers, chaplains, and of course it's a 24/7 facility.
Okay. So it is staffed 24/7 with nurses or counselors, or
so that's
all of the above.
Yes, so that's what you call an inpatient level of care.
Does hospice supply support after a patient dies?
Yes, and that's actually my department. Every hospice is chartered to give care to the dying and the bereaved. And so we follow our families for at least a year, sometimes more. We have many, many programs. If you go to our website, you see a long list of support group programs and special workshops. We have a summer camp day for children. We're the only hospice in our area that runs a continuing program for children.
Okay. Now, what types of programs do you offer? or a workshop, for example?
Oh, you mean for the bereavement department? Well, workshops are often on a specialized topic, like loss of an adult child,
Okay.
young widows, loss of a parent for adults. So we try to bring people in to a group that where the makeup of that group is as similar to their kind of loss as possible. And then we have many general bereavement groups where anyone with any kind of loss can come into them.
While on hospice, can someone use their own doctor, or do they have to use specific doctors?
No, in fact, we encourage people to stay with their own physician, but we have our own medical directors, and they work with the patient's physicians.
So that they would be in actual discussion
Yes.
with the physician?
Yes.
Okay. Does hospice do anything to make death come sooner?
No. No, we neither make it come sooner or later. It's a natural process.
My mother, if let's say my mother was in a nursing home or someone's in a nursing home, can they receive hospice in a nursing home?
Yes, and this is really the beauty of hospice and how it was envisioned, you know, decades ago. Hospice is wherever home is for you. The idea of hospice is to be home. If you recall, like back in the 70s, you couldn't take your family member home from the hospital. So hospice grew up out of that desire for families to kind of get some control back for their loved ones.
So whether they're living in their own home,
Yes.
or in one of their children's homes,
Yep.
or a nursing home.
Any facility. Or if, as I said, if they need that inpatient level of care, there's hospitals or Hospice House nursing homes.
Now, who pays for hospice? This is always, you know, this part amazed me.
Well, it's a benefit of Medicare, for one thing, and then it's also paid for by most insurance plans.
So generally, there's no out-of-pocket expenses to have this.
No, generally not.
And I think people imagine that it's like other home care services that you have to pay for or contract for, but it isn't.
It really depends on every family, but as I said, it is a Medicare benefit, it is an insurance benefit, so for most people, they have coverage.
Okay, let's say, what cities? What cities and towns?
Oh my goodness, you're not going to believe this, but we're now covering 90 cities and towns. I mean,
Your own hospice area.
Yes, we've grown so much. Our area has grown so much. So we have several teams covering all around. It's grown so much over the years, and really, it's wonderful.
From Georgetown, what would be the furthest distance?
From
in
Georgetown.
the general directions?
Well, we're now serving the coast of southern Maine. We're down to
Maine?
Yeah, yeah. And we're down to we go to Peabody and Lynn. We go all the way out to Groton, Massachusetts. Of course, southern New Hampshire.
Now, are there other hospices in these areas as well, or are you covering that many because there is no hospice in that area?
There are other hospices. In fact, hospice has grown quite a lot as an industry over the years. We are a not-for-profit hospice, and as I said, a very old hospice. So we've been the trusted name in hospice in the Merrimack Valley for many years.
Yeah. I went online, and I always do before I do a show and an interview, and there are so many different kinds out there.
Yes.
Some are for-profit.
Yes.
Some are connected with hospitals as opposed to being something separated. Some were connected with colleges. There were all types of different things that I was really surprised.
Yes, it's changed a lot over the last 20 years.
I remember many, many years ago, there was someone in town, and it was, you were only called hospice when it was the very, very end.
Yes. I know.
And it's not like that anymore.
No, it isn't. It isn't. And it's important for people to understand that hospice is about managing your care your way. And we have a wonderful palliative care program, so that's pain management.
Okay.
And So you'll see, you'll see the term hospice and palliative care. So for many people, even who are doing curative treatments, they really need good pain management, and they can turn to hospice for that too. And then also, we're one of the few hospices that has pediatric palliative care.
Okay, you said curative care. Usually people are not doing hospice and getting curative treatments at the same time.
No,
Okay.
what usually happens is, as I said, it's all about phases of care. And so people will decide maybe that the curative care is no longer viable for them. And
by curative care, we're talking things like chemotherapy,
right,
surgeries,
right,
the things that the doctors would provide.
right,
And when they don't think there's anything else that the doctors can make it all better.
right.
Okay, okay. Palliative care. So what would be involved with that type of thing?
So when you think you could use some, help managing pain, you can have an assessment done, an evaluation for palliative care, and so our nurses come in, they evaluate you, our team comes in, and then we see if that is going to work for you.
How does someone find out, let's say, a recent bereavement? How do people find out what you offer and what you can do for them?
Okay, so there's two ways. One is if your loved one was a patient on our hospice. So then you are receiving a lot of support from us, not only calls, visits, but also we send out we send you letters and resources throughout the whole first year. You are made aware of our groups, our special programs. If you have children in the home, you receive the literature in our children's program. And then, of course, there's always our website. And it's pretty much, you can find everything you need right there.
If someone really questions, is there an easy way to get hold of you?
Oh yes, they can just call Merrimack Valley Hospice. We're, just call our main number. They'll get you right to the department that you need.
Okay. I think, have we covered everything?
I think so.
I think we have. Thank you very much.
Thank you
I really
so
appreciate
much.
it.
I appreciate it very much.
Do great work.
Thank you.
I'm Beverly Enos. This is Spotlight Georgetown. Fridays, Saturdays, and Sundays, 8 a.m. and 8 p.m. Thank you for joining us. Bye for now.